My name is Alexy Arauz-Boudreau, and I am a community pediatrician at MGH. I also hold the titles of Associate Director for Population Health at MGHFC, as well as an Associate Director for the Center for Diversity and Inclusion at Mass General Hospital. One of the best things about working at MGH Chelsea Health Center is certainly my colleagues. They are dedicated physicians and staff who understand what it's like to practice in the community where there are high social needs, giving themselves fully to the practice and trying to connect with patients wherever that patient might be. They are examples that I try to live up to on a daily basis. So CDI has always been a place for me to connect. I remember my very first interactions with CDI were around making relationships with other interns who might have similar experiences to my own, but be in very different departments, and otherwise I would have never have met them. My main area of focus is how do we work in teams that are cross-cultural. I've been developing and spreading a training course on cross-cultural conversations, really focusing on how teams that have historically hierarchical relationships can come together and interact in a way that is conducive to improved satisfaction, both working within the group and then also provide better outcomes for our patients. The CDI Clinician Teacher Development Award allowed me to begin a project back at Chelsea that was clinical and really got me into the community. It allowed me to address needs that clinicians had seen here, an epidemic of obesity, and think about ways that we could re-engineer primary care to address the growing epidemic that we were faced with on a daily basis by our patients. I was able to put my health services research skills to a test and really start to develop what my career trajectory would be in addressing how we restructure primary care to serve the most vulnerable populations. Not all my mentors, or I should say most of my mentors, have not looked like me, but through both formal programs that CDI has helped to sponsor and through informal networks, I have been able to obtain advice when I've needed it, guidance when I really haven't been sure what to do, and have reaffirmed a commitment to stay because people are genuinely interested in what my career will look like, not just tomorrow, but even 10 years later. I often wonder if I would ever be able to leave this health center. And being a Latina, the daughter of immigrants, being told at various points that I could never become a physician, I feel it is imperative that I continue to practice with kids who remind me of myself, who've had various doors closed up on them, and who can't really envision what the world would look like outside of their community. Practicing here gives me an opportunity to mentor them. I want them to know, yes, you can. The reason why I have stayed at MGH throughout my medical, residency, and fellowship training is because of the support I have received from wonderful mentors, from colleagues and friends. I cannot think of a more nurturing institution than MGH.